Well, we welcome Dr. Travis Gratton with University Veterinary Care Center for this week's Pet Advice segment, and we're talking ticks. Those nasty, nasty little bugs, and more importantly, how to prevent some of the diseases that they can cause. So good morning. Thanks for being with us today.
Thank you.
I know there are actually a number of diseases that they can cause. You know, a lot of us have heard of Lyme disease or the Rocky Mountain
spotted
fever.
Yep.
But what are some of the other ones that are commonly found?
The biggest one we see in this area is it's a weird little bacterial disease like Lyme's and Rocky Mountain spotted fever, actually related closely to Rocky Mountain spotted fever, is Ehrlichia, and it's just another one of those little blood parasite things that gets picked up from one infected animal. The ticks hold it for long periods of time, hop on the next victim coming by, and if they're attached long enough can transfer it. The bigger one, and certainly there's some others with odd names that most people don't see, but they do pop up occasionally, and especially if you travel at other parts of the country or world, there's really some bizarre things that are spread by ticks. But for cats, there's a protozoa called Cytauxzoon, which is just absolutely horrible. The strain we get in this area is just resistant to treatment. We just don't have a good option for it. So.
Oh, yikes. Well, how common are they?
They're not really high on the list. You know, certainly we see other things, the cancer, the heart disease, kidney failure, things like that, much more frequently, and that. But we see several Ehrlichia cases, and I'm sure every practice in town sees the Ehrlichia case here and there, an occasional Lyme disease. Cytauxzoon obviously is much more of a newer thing, not that common over the last or prior to the last 10 years or so, but has become kind of endemic in the area, often called bobcat fever, and that's the intermediate host for the ticks. They feed on bobcats, and so there's a lot of them in this area.
Yeah, I had one in my backyard a couple of years ago, yeah. Well, what are some of the general symptoms, and then is it treatable?
Most of them caught early and diagnosed early, although that is tricky and difficult. These are weird little diseases that are partly because they are uncommon and partly because of their life cycle and the way they affect animals. Fevers are kind of the consistent thing across the board. They attack red blood cells, white blood cells, platelets, and then there's an immune response to those organisms in the cells, and so you get the fever, the lethargy. Sometimes it's cyclic, kind of comes and goes. Other times, like with the bobcat fever in cats, you get these really high fevers, and then it just progresses to organ failure. They can be really devastating.
Yeah, you don't want that. So how can we prevent this?
Well, and unfortunately, I was here a couple weeks ago when there was snow coming down. We were talking about mosquitoes, and they never go away. We had a 20-degree below zero morning a month and a half or so ago, or 2 months ago. That doesn't kill ticks. The cold weather, they just become inactive. They come back every year. So it really kind of three big strategies. One is avoidance. If you can stay away from the taller, deeper grass, the brush, the shrubs, out in the woods, you're not going to see many ticks in the manicured urban landscape. So kind of stay away from them as much as you can. Certainly removal. If you get the occasional trip out into the woods, the fields and whatnot, and they're playing, give the dog a good once over, or cat potentially, and remove them. Grasp firmly at as close to the skin as you can and pull straight out with kind of slow, methodical pull. Physical removal before they have a chance to be attached for long can prevent transmission of some of these diseases. And then, of course, there's a variety of things for dogs particularly that work very well as far as preventatives, both topical and oral, that are working better. Some of the newer products especially work very well for tick control. Cats are a little more limited. There's only a couple products that really work well because cats are much more sensitive to toxicity of the insecticide classes, and so there's just not been great choices up until the last couple years for them.
All right, good tips for pet parents. Dr. Gratton, thank you for being with us today.
Thank you.
And if you'd like more information about University Veterinary Care Center, just head over to universityvetcare.com.